Good afternoon. I'm Patricia McKenna from Shields for Families. I wear a few hats at Shields, as many of the managers do there. I manage a program which is called Project ABC, about building connections, which is a 3-agency collaborative in the state of Los Angeles, not the county of Los Angeles, because it's a ginormous county. And I also am the manager of an assessment center where anyone in the community with a substance abuse disorder comes in for treatment linkage, which we can link as fast as 2 hours, or we can, if the client is not willing to begin treatment right away, we can make those arrangements. And then I think my most significant role with Shields, I've been with Shields for almost 23 years, has been working with families in the Los Angeles County Child Welfare System. I'm kind of the go-to person at Shields whenever there's a problem with a very high-risk case. I supervise 2 staff. One is at a local child welfare office in the city of Compton, and the other staff is actually co-located at Children's Court in the county of Los Angeles, which is the courthouse where any child that has been removed or is being monitored through the child welfare system, through the court system, they receive about, on average, 50,000 referrals a year, which are all investigated, by the way. So it is, when I hear families that have the child welfare cases, and we didn't even touch on just, half a quarter of barriers that families face. You're talking about a system, and it has gotten much better. I will say that in the years that I've been, assisting families, it has gotten much better. It's still a very difficult, cumbersome system to navigate. And I think for a parent who has gone through the trauma of having their child removed from them, not to mention the trauma that the child or children are going through, to navigate through that system is beyond tedious. It is not a parent-friendly system. It is, in the criminal court system, you are innocent until you're proven guilty. In the child welfare system, you are guilty until you can show something different. You're putting many, many, many requirements on a parent, where you're telling them they have to do substance abuse treatment, they have to do counseling, a domestic violence class. As Abraham shared, Los Angeles County is massive. He's got a child 1 hour and a half away in one direction, 1 hour and a half away in another direction. You're required to do visits with each child, plus your substance abuse program, your mental health counseling, your domestic violence, plus test, get a house, get a job. How do you do that? So I think our role, as we really have, I think, done a fantastic job in being almost a one-stop shop. What we don't provide is wraparound services. But anything else, we really try to start minimizing barriers for families at intake. The minute they come in the door, we start engaging with social workers, with a probation officer, a parole agent, whatever that person is willing to share at that moment. Of course, once they get into treatment, you gather much more information because you are building that relationship. A lot of it is just word of mouth. A lot of it is referrals from different entities. So we do our best to really meet the family, because we are family-centered treatment. We are a perinatal provider. Most of the women that come to us are coming to us pregnant or have just delivered a baby. We are co-located at 3 local hospitals in Los Angeles. So we start the process right away. But parents amaze me. You're so resilient. You just don't know. So thank you.